Hello and welcome to our daily update on COVID-19. It's March 22nd, Sunday, and I'm Akhil Kadidal. In the next few minutes, we'll bring you updates regarding the spread of the virus across India, with specific focus on Bengaluru and Karnataka. First up, at the time of this recording, 349 people have tested positive for the novel coronavirus across India. That is an increase of 25 cases since yesterday. The number of deaths, which was stable at 4 until yesterday, has climbed to 7 today. Bihar reported his first death due to COVID-19 today. The victim is a 38-year-old man who had returned from Qatar and was admitted to the All India Institute of Medical Sciences in Patna on March 20th. 2 other people have tested positive for the virus, and the state has decided to screen all passengers returning from Maharashtra for the infection. In Maharashtra, a 63-year-old man succumbed to the coronavirus late last night. He had been admitted to a private hospital on March 19th. The patient had a chronic history of diabetes, high blood pressure, and ischemic heart disease. He developed acute respiratory distress syndrome, which led to the death. His wife, who also tested positive for the virus, is still in isolation. Gujarat also reported its first death due to the virus. The victim is a 69-year-old man. A 65-year-old female also died at Vadodara Hospital, but her first test report for COVID-19 is awaited. Currently, Maharashtra has the highest number of confirmed cases in the country, 74 individuals and 2 deaths. Kerala is next with 52 cases but no deaths. Delhi has 27 confirmed cases. Uttar Pradesh, 26. Karnataka has a total of 26 cases and 1 death so far. The state has added 6 new cases today. For updated figures, follow the live blog on the Deccan Herald website. Following the spike in cases, a series of decisions had been taken at a meeting chaired by the Cabinet Secretary, the Chief Secretaries of States, and the Principal Secretary for the Prime Minister earlier today. It had been decided that 75 districts across India which have reported infections and deaths will be locked down. In Karnataka, the districts under lockdown are Bengaluru Urban, Bengaluru Rural, Kalaburgi, Mysuru, Kodagu, Chikbalapur, Dakshina Kannada, Dharwad, and Belgavi. Non-essential passenger transport, including interstate bus services, will be restricted until March 31st in all 75 districts. In an unprecedented move, Indian Railways will stop operating 13,523 trains from midnight today to midnight on March 31st. All metro rail services on all operational networks across the country will be closed until March 31st. Mumbai suburban services and Kolkata metro rail service will continue to run until midnight today, after which they will be stopped until March 31st. Full refund for all cancelled trains will be provided up to June 21st. Only goods trains will be allowed to run to facilitate transport of commodities. The last time that Indian Railways has shut down operations was in 1974 for just 3 days, during a railway strike in which 80% of services stopped. Following the spike in confirmed cases in Maharashtra, Chief Minister Thackeray announced the imposition of Section 144 starting at midnight today in the entire state. Government offices will function at 5% of their strength. However, banks and stock exchanges will function as usual. Delhi will also be locked down starting tonight till March 31st. The Delhi police will also invoke Section 144 to prohibit any gatherings. Delhi Metro will also suspend operations in the NCR. Earlier today, 263 passengers from Rome arrived in Delhi on an Air India flight. Most passengers were Indian citizens who were stranded in Italy. All the evacuees have been taken to ITBP Chawla quarantine facility. Moving on to Karnataka now, the state has added 6 new confirmed cases today. Patient number 21 is a 35-year-old man from Dharwad with a travel history to Dubai. He had traveled from Dubai via Goa to Dharwad on March 11th. 4 primary contacts have been identified so far. Patient number 22 is a woman, 64 years old, who tested positive for COVID-19 today. She had traveled from Mecca, Saudi Arabia, along with her son, patient 19, to Gauri Bidnoor in Chikbalapur district on March 14th, via Hyderabad to Hindapura by train, and from Hindapura to Gauri Bidnoor by bus on March 15th. 4 primary contacts have been identified so far. Patient number 23 is a 36-year-old woman from Bengaluru who had traveled to Switzerland from France. She had returned to the city on March 9th and is being treated at a hospital. Patient number 24 is a 27-year-old man from Bengaluru who had traveled to Germany on February 8th. He returned to Bengaluru on March 14th. 14 primary contacts and 237 secondary contacts have been identified. Patient number 25 is a 51-year-old man from Bengaluru who had traveled to London and returned on March 13th. 6 primary and 10 secondary contacts have been traced. Patient 26 is a 22-year-old man who arrived on a SpiceJet flight on March 19th from Dubai. He's a resident of Batkal, Uttara Kannada, and the first case to be reported from Mangaluru. Karnataka Chief Minister B.S. Yadurappa, heart surgeon Dr. Devi Shetty, and other members of the Karnataka Task Force met early this morning to take major decisions on the monitoring and control of the coronavirus outbreak in the state. Among the decisions the state government has taken is that it will shut down all borders with its neighboring states to tackle the COVID-19 pandemic. SSLC exams in the state will be postponed. Primary and Secondary Education Minister S. Suresh Kumar said that fresh dates will be announced in the first week of April. However, the last second PUC exam on March 23rd will be held as per schedule. The Chief Minister has also decided to convert the 1,700-bed Victoria Hospital as an exclusive center for COVID-19 treatment. Among the fears of low testing, measures are also being initiated to add more government and private labs to test the number of cases in the state. The National Institute of Virology of the Indian Council on Medical Research is being roped in to ensure licensing for such labs. It has been decided that all domestic air passengers will be screened along with international passengers from now on. The task force has also decided that all elections scheduled for local bodies and cooperative societies will be postponed. The Balburi guest house will be converted to serve as a war room for coronavirus operations. The Chief Minister said that all measures will be taken to ensure the supply of essential commodities in the market. He also requested people to avoid travel to villages to control the spread of the pandemic. Moving on, central government employees above the age of 50 years who suffer from diabetes, respiratory, and renal diseases are allowed to take commuted leave until April 4th without producing a medical certificate, according to an order issued by the Department of Personnel and Training. Central government offices will operate with skeletal staff until March 31st. As COVID-19 cases continue to rise in India, attention has begun to shift towards hospitals to make sure that they are equipped to take on the influx of cases. A total of 535 designated hospitals across Karnataka have been identified for the isolation and treatment of suspected COVID-19 cases. Of them, 203 are public health facilities and 332 are private setups. 2,658 beds are available for isolation. 1,114 of these are in government facilities and 1,544 in private health facilities. Since COVID-19 patients suffer from respiratory distress, ventilators are crucial. The government health facilities have 234 ventilators and private health facilities have 506 ventilators for COVID-19. Chief Minister B.S. Yadurappa announced on Friday that the purchase of 500 ventilators is underway. B.G. Prakash, Joint Director of Communicable Diseases, said that the calculation of the required number of ventilators is made not based on the population, but on the number of positive COVID-19 cases. In Kashmir, Super Speciality Sher-e Kashmir Institute of Medical Sciences Hospital in Srinagar received 20 ventilators, the first batch of the 50 it had recently placed an order for. The ventilators will be allocated for the isolation ward, meant to provide life support for critically ill COVID-19 patients. Currently, the 800-bedded SKIMS has just 38 ventilators. Moving on now to the Janta curfew, almost all of India came to a standstill today. Bengaluru's crowded bus stand was deserted and people played cricket on the streets. In Mangaluru, roads were empty and people stayed away from the central market and the fish market. Except the civic workers of Anthony Waste Handling Private Limited that handles waste collection in the city and the police personnel on duty, there were hardly any people on the streets in Mangaluru. The Janta curfew evoked a strong response from the Kalyana Karnataka region. Kalaburgi, Bidar, Yadgir, Raichur, Koppal districts stayed shut. Kalaburgi Deputy Commissioner B. Sharath has extended prohibitory orders imposed under Section 144 until March 25th. The country's first COVID-19 victim died in Kalaburgi district. In Raichur, a few passengers were stranded on the Karnataka-Andhra Pradesh border as vehicles were not allowed at the checkpost. The Hyderabad police decided to round up people roaming around the streets and made them hold COVID-19 awareness placards. It is unclear who the audience was. The Tamil Nadu government has extended Janta curfew by another 8 hours till 5 a.m. on Monday morning. The Telangana CM has also announced that the curfew will be extended to 6 a.m. tomorrow. That is all we have today. Stay safe, and for the ongoing coverage on the coronavirus, log on to DeccanHerald.com.